Now I can not just say, hey, massage is going to be really beneficial for your pet, but then I would also add in this supplement because of this reason. And then I have that as well to give. Hey there, this is Michael Daly, a certified holistic pet health coach, certified canine massage therapist, certified equine shiatsu massage practitioner, and I am stepping in for Dr. Roberts today for her live chat. And with us is, and I have to read it so I have everything right. So I know your name.
Good.
Ashley has a bachelor's in health science, MBA, and owner and founder of Bark and Bunk in Marietta, Georgia, which is a doggy daycare. And she just celebrated year 3 and is super excited for this next year. So welcome, Ashley.
Yay. Thanks, Michael.
Ashley so I got to quote unquote mentor Ashley in the holistic pet health course. And so it was really fun because her and I are very much alike on how we think. And so it was really, really fun. And we got people already saying hello. Hey, Barbara, and hey, Lori. Lori's another one that I mentored as well, who's really amazing. And yeah, what we thought we would talk about today is, so Ashley and I are two people that came into the holistic pet health coaching course having owned businesses already dealing with animals. I was a vet tech for a long time, and then I also had a canine massage therapist business. And then Ashley had her Barks and the doggy boarding facility. So how do you feel like how have you been doing since you have graduated from the course, and how do you feel like it's been helping you with your business?
Yeah. So I started Bark and Bunk 3 years ago. And from my journey through the program, about almost, maybe 7 months ago when I started adding certain things that I was learning, not just from, obviously can't do food with my clients, but like other natural alternatives, like the laundry detergent that I use to wash towels and blankets. It's all natural. The product that I clean the floors with, that I clean the crates with, I don't use any chemicals, bleach, any of that kind of stuff. And in terms of like cleanliness for the dogs, if they like to play fetch or like ball, then I have 1 ball per dog. I don't let them share it because you never know. Just with the mysterious illness that came out, like you just never know how dogs can get germs and that kind of stuff. And then a lot of the dogs that stay, they have anxiety or they're stressed out, which is totally normal. I got a lot of like COVID dogs, and I still continue to get them, which is like they were adopted during COVID or like they didn't go out during COVID, which is like my dogs too. So I totally get it. But they're nervous, right? They don't know where they are. And so if they do have like upset stomach or something like that, then I have pumpkin on hand to help. I also have some like probiotic kind of gel or paste that I'll give them too if it's like more serious. And that usually helps right away. So I try to take it one step further, just saying, okay, this dog isn't feeling well, cool. But I want to help them because I want to make their stay as best as it can be and enjoy the time while they're here. And I have all the knowledge now, so I'm going to use it. Yeah, it's really turned it around in that perspective and made me unique in the boarding world.
Absolutely. Yeah. Because I think it's a lot of times we go to the boarding facilities and we leave our pets, and some people board for weeks on end, and sometimes that stuff comes up and you have people that own the facilities that aren't really sure how to treat them or what to do with them. So it must be really comforting for clients to be able to bring their pets to you and know that you have the knowledge that we learned from the course. Because I think that's one of the strong points of the holistic pet health course is the backing that we have. We aren't just out there telling people to use this supplement because we just heard that this supplement worked or we used it. We actually are educated in different organs and parts of the bodies and diseases and things like that, so that we know why these supplements work and what they are used for. So I know that for myself, I worked for Dr. Roberts for a really long time. And then I started the massage business, and that was my big strong point with massage, was that I wasn't just doing massage, but I was also talking to people about diet and supplementation and things like that. But I was giving the information away for free, basically, which I don't mind doing. But at the same time, I was like, well, this could be something else. And so the course for me was amazing to integrate that in, because now I can not just say, hey, massage is going to be really beneficial for your pet, but then I would also add in this supplement because of this reason. And then I have that as well to give. And also, even as a technician, I was a tech for 20 years, and there was stuff I learned in the course that I was like, oh, that's why we did that. Or I'd be like, God, Dr. Roberts must have thought I was. So yeah.
Yeah. And like a lot of times, before I had this knowledge, before I went through the course, I felt bad for a lot of the dogs that would stay, because the owners would be like, yeah, they just won't stop scratching. And I'm like, gosh, like I wish I, could help. Or they can only eat this one type of food, the hydrolyzed protein, those diets, because anything else gives them diarrhea or upset stomach. And so now that I have this knowledge, same like you, Michael, I'll just give them helpful advice to get them started. And one thing that I found a lot is our clients will say, what do you feed your dogs? Or what do you do? And I'm like, I cook for them, but there's a whole lot more that goes into it, because no two dogs are the same. So there is like a simple answer, but also what is going on with your dog? You know what I mean? Let's review the vet records. Let's dig a little deeper, just because I don't want you to go down this other path and still have issues because we didn't really fully look at it. So
absolutely. Yeah. Yeah, and so we got Julia Johnson from Vermont. Hey, Julia. And Bridget Flowers from Mississippi. Hey, Bridget and Julia. Welcome to Ashley and I just rambling on about things. So I thought so normally we answer some questions, which we are more than happy to do. So if you guys have any questions that are watching, please shoot them to us. But this course has been around hey, Becky from Scottsdale. I love Scottsdale, by the way. And I lost track of thought because I was thinking about Scottsdale. I've been certified. So I was one of the first ones to get certified in this course. And so I've been doing it for about a year. And it's a newer course. I feel like we don't really have too many stories really yet of successes. So I thought I would share with y'all. And I think, Ashley, you had some personal experiences yourself. So I thought I would share some of the stuff that I had gone, because I went through, when New Year's came, I went back in the year, because I have been slowly doing this here and there, whether it was just like introducing some people to the diet or having full-on consultations and things like that. So I thought I would, if I do this correctly, share my screen to my Facebook. I always have to be careful my Facebook because it's an acting Facebook too, so hopefully. Let's see. All right. Can you see it, Ashley? Is that good? Okay. All right. I went through, and I really was, as I was thinking, I was really like just so happy and surprised with the pets I was able to help this past year as a holistic pet health course as a coach. This guy, Finn. So Finn, I've known Finn for probably about 11 years, and I met him at Sundog Cat Moon, and I actually ran into him last year when I was doing massages at a doggy daycare here called Paws in Paradise, and I was working on him, and I was like, I know this dog. I know this dog from somewhere, and I knew him. And then I realized when I looked at the name who it was, and I had not seen him in, I can't tell you how long. And so I met with his mom, and his mom had said, and I remember one thing I specifically remembered about Finn is that he had really bad skin issues. And he was on Dog Cat Moon. I remember he was just always for skin issues. And so when I had gotten in contact with her, she had told me that he's been on Apoquel for about 8 years, had been on a hydrolyzed protein diet, all things like that, and got together. And she was so excited because she remembered me from Sundog Cat Moon, and she was like, oh, I want to get back on the crock pet diet. I would love to do that. So we did, and I developed a diet for her, and then we went through some supplementations to help with skin. We did some gut support to help with that, and we did an allergy test. And so we used that allergy test, as I always said, as a roadmap into what certain proteins and foods would be best for Finn. And we followed that, and he started looking better. His energy was good. He was still on the Apoquel. He would still itch off and on. And so I had her do that for about 3 months, and then I had her try stopping Apoquel. And the second she did, he immediately went back to itching. She was really scared just to get his skin back to where he was. So we went back on the Apoquel and just continued to keep doing everything. And it was the funniest thing. So like around month 10, I went to go work on him because I massage him too. And she came up to me and I was like, yeah. And she was like, so I went out of town and my kids were watching Finn and they forgot to give him the Apoquel all week. And I was like, oh, really? And she was like, and he hasn't itched. And I was like, yeah. And I was nervous that I was whispering. I was just like, oh my. And that was probably about 3 months ago, and he hasn't been back on Apoquel. And it's been really great because this is a dog that has been on Apoquel for that long. And his energy is better, his coat looks better, the color is better. So I was really excited to see that success story. But also, I think a big part of it was the fact that this stuff isn't overnight, what we do, right? The supplementation and food, because the problem is that we live in this world where we want instant gratification. So I want this fix on my arm right now. So we'll take that drug to fix it. Instead of deferred gratification, where we're going to fix something externally by working internally. And that's what functional medicine and this kind of stuff does. So I think that's a key point to remember is that there's a lot of patience but God, when it happens. So I was really excited about that.
That's awesome. Oh.
Yeah. How about you? Do you have any stories with your guys at all?
Yeah. So I have 4 dogs myself, ranging in ages from 9 to 2. And I will say Murphy, my oldest, has had ear issues, just every once in a while scratching and that kind of thing. And since being on the crock-fed diet, very minimal now. And he was taking histopause and some quercetin and just for extra support. But that's helping. I didn't have to resort, thankfully, to Apoquel. Now, there are good use cases for it, like Michael said. Sometimes they need the stronger drug to get it under control, and then behind the scenes you kind of work to build up a more substantive plan for them. But luckily with Murphy, I didn't have to. He did get some medicine in his ears and that kind of thing, and his coat's a lot better. He did have a nice coat before, but it's super soft. His energy is, people that know Murphy from before and now, it's like a different dog. Like he's out there playing with toys outside, getting toys out of the toy bin. It's so cool. It's just he's his young self again, and it's really sweet. And yeah, just energy all around with them, like eating fresh foods. They all naturally lost a little bit of weight just because it's not heavy on carbs and it's not inflammatory foods like kibble is. Nico has been overweight most of his life, and now he's ideal. He's right where he should be, and that's just because of the food. I didn't really have to cut back any on that he was feeding. So I have a client that she'll actually be here for boarding in a couple days. But she has been on same kind of thing, skin issues. She's been on Apoquel for several years. And I knew her from the rescue, which is cool, that I volunteer at. So I've known her for a long time. And I got the dad and him started on crock-fed and that kind of thing. And she's drastically changed. And since I know her from before and now, same thing. Like she is still an Apoquel just because we want to make sure it's a slow process, weaning off, and he'll work with his vet to go that route. But yeah, she is on the crock-fed. She gets a probiotic and then on histopause, which is like an anti-inflammatory for allergies, and totally different. So much more energy. She's not nipping at herself as much and scratching. Coat is so much better. Her she has too much energy now. I can't keep up with her. So it's really cool. And a lot of it that I've learned through the course and the clients that I'm helping, it's all very like in line with us as humans. And it all starts in the gut.
Right.
Pretty much every time. I'll immediately go to the diet. What are you feeding? And a lot of times we just don't know from the big corporations, the big commercial foods out there. We just didn't know. And so now with courses like this and the coaches and just like finding another world of holistic options, alternatives. It's really cool to know that there are other options out there if that's something that you're interested in. And it works. It's haven't heard a bad thing about feeding fresh food. So it's really cool. It's definitely changed my life and my dog's life.
That's awesome. All right, we got some questions here. Oh god, here we go. Let's see. Oh, how do I scroll up? Oh, there we go. All right. All right. Barbara Richard. Oh, she's got a couple questions here. Let's see if we can all put it all together. My 10-year-old rescue poodle developed huge, large marble-sized cysts. They had no head. They were found by palpating the area. One near her face became so large at first that the veterinarian thought it was an infected salivary gland. There was also a, let's see. Sorry, bro, I'm trying to read. So it looks like, okay, so when that didn't resolve, they did antibiotics. So they clindamycin 75 mg twice a day. I'm gonna skip down here, Barbara. She feeds raw food. I'll provide senior. Same question. Let's see. When the mass, there was also, sorry. There was also a large one on her front right shoulder. Lancing them didn't cure them. Gotcha. All right. When the mass didn't resolve on antibiotics, okay, I'm waiting on culture results. I've started turkey tail. What else should I try? She is, oh, there we go. Oh, you can do that.
Oh,
That's neat.
sweet.
That's so
Hi.
cool. All right, yes. I don't know how to not get back to that though. All right, so basically what else can you do to see about the cysts? Oh, there we go. Perfect, okay. So Ashley, any thoughts on that? Did you?
So, yeah, I saw enough of it that because my Murphy has one cyst. You can see it from the outside too. And he also has a few fatty lumps on his sternum and belly. And the course is founded in traditional Chinese veterinary medicine and learn about it's all about energy. So it's a parallel to energies versus like actual organs of the body. Warm and hot and cold. And so it's all about balance, bringing the body into harmony. Lumps essentially form because there's too much phlegm. There's too much cold, wet, and damp in their body. And so if there's a lot of cold, you want to balance it with more warming, energetically warming foods. So whether it's protein, veggies. So in that case, like I've been feeding Murphy more chicken or lamb because those are warming proteins to help decide the dampness, and kidney beans for drying. So definitely I found like the type of food matters too, not just if they're like sensitivities, but the energy related to those foods is where I would start. Turkey is more of a cooling protein. So that's just something to think about from a protein standpoint. And I also use for him that's actually worked. I don't know if you've heard of Barbara's My CBD Dog Health. They have a salve which is full a CBD spectrum, and it's essentially for lumps. And you put it on their skin, and you get it as close as you can because there's the coat and the hair. But it's amazing. It makes it worse at first, and then it starts killing all the bad cells, and then it starts shrinking. So CBD has been wonderful. They have a salve, they have oral options, but definitely food is where I would start, and then layering in some other options to help.
Great, excellent, good. I'm very proud of you. So yeah, Barbara, yeah, Ashley is absolutely correct. So yeah, so it's tough. I see your questions there. So it's lumps and bumps. They're a tough one, especially as pets get older. It's one of those things that even at Sundog Cat Moon, especially if they're just more like cystual. Of course, it's always good, like you did, to have the vet check them out to make sure that they're nothing more serious, like cancer or anything like that, or infected, of course. But it's tough with older pets to make them go away. To be quite honest, I rarely have seen that, even with food and functional medicine, and maybe with Chinese medicine I saw it. But really, the goal is to prevent more from coming. And so Ashley's right. So in Chinese medicine, those little nodules are called phlegm, and it is a cold, wet, damp sort of idea. And so one thing to think about with a raw diet, so the original crockpot diet, which is what was invented by Dr. Roberts, is based in traditional Chinese veterinarian medicine. And the idea with Chinese medicine, food enters the spleen, which is the stomach, and the spleen's job is to transform that food into gu qi, and gu qi, which is the essence of life, goes into the other organs. And the idea is that the best way to transform food into gu qi is when food is cooked. So that's the traditional Chinese veterinarian medicine, cooked food. And so to start actually making home cooked food and cooking it to see if that can help with transforming that food into gu qi. And then in turn, you're actually balancing out the yin and yang of a pet. So you have yin being cooling, yang being hot. So there's a little bit of off balance there. And having done that along with using proteins like turkey is cooling, chicken would be hot, lamb is hot, beef is neutral, things like that, you can balance out the yin and yang in that sense. Also, you can add in certain things that help resolve phlegm, which I need to look up real quick because I can't think off the top of my head. Let's see. So I would think like more something like ginger is an herb that can help resolve phlegm. Herbs like that, mustard, ginger, herbs you can add in there to help resolve phlegm. It's that idea of if you think about like phlegm being like spitty and then you want something to absorb that spit, it just has that feel to it with Chinese medicine. And then you had mentioned also turkey tail. And so there is a product called Vitality by, I think we want to do Vitality by Michael Dog, which is invented by this wonderful woman, Angela Ardolino. I'm going to share my screen here because I'm going to see. How do I do it? There we go.
Yeah, my pups are on Vitality too. It's
yeah. I have every dog on Vitality. So what's great about Vitality, Barbara, is that it has a combination of mushrooms, not just the turkey tail. So it's got all these: turkey tail, reishi, shiitake, maitake, chaga, artist. I always got to fight these 50% off things. Red belted concha, astragalus root, and then it's all extracted from a mushroom and then combined with ashwagandha, which is an anti-inflammatory herb. And so it's this particular one. So there's a couple. She's got Vitality, Breathe, and actually, what's the other one?
Clarity.
Clarity, yes. And so Breathe is for pets with congested issues. Clarity is for pets that have more cognitive issues. And Vitality is, so it's a blend of naturally grown mushrooms extract. This formula was designed to help support dogs dealing with cancer, autoimmune disease, liver issues, and respiratory issues. So I would put cysts in sort of an autoimmune area that has to do with immune system. So this would be a good product to add in. And then the BD. Oh, thank you. And they're putting in the amazing Crockpet Carrots is amazingly putting in links for that as well. Awesome. Thank you. Is that immaculate? Thank you. Who is that? Awesome, Barbara. And then also the CBD. What is the brand CBD, Ashley?
My CBD Dog Health.
My CBD Dog Health. Thank you.
And it's also founded by Angelina Ardolino.
Oh yeah. I always go to mushrooms first. And CBD is amazing. CBD is the one thing that helped my cat with everything. If Lori was asking if you have one with cognitive issues and inflammation, I guess you can't use both. I would probably, so all three, Lori, deal with inflammation. So you could just use the Clarity. So that's gonna handle inflammation too. It's just sort of certain mushrooms, and a lot of the same mushrooms are in the other ones as well. It's just certain ones have maybe one or two or three that deal with that particular issue. And then
he also, on the site, as he's pulling it up, she'll have recommended like bundles, if you will. So for most effectiveness, the salve with the tincture, the CBD tincture.
Yeah.
So the remedy with the heal is what I have for my pups, especially Murphy and Nico that have the lumps and bumps.
Mm-hmm. Yeah, just go to CBD Dog Health. I think it's going to take me a second to find it. Yeah. Absolutely, Barbara. Absolutely. All right. Let's see, another question I want to miss here. Ashley.
Huh?
Good job. All right, Helen Brunson. I recently rescued a Merle Yorkie, Merle, from a breeder. So of course she isn't spayed. She's been through a couple of heats and they've been no big deal. That's good. Vets in our area won't even speak to you if you can. I know. I'm sorry. I know. Oh, let me show this, Ashley. I'm sorry.
Okay, cool.
I love that. I love that thing. So she's through a couple of heats. They've been no big deal. Vets in our areas won't even speak to you if they can't give your pup a litany of vaccinations, and their spray prices are $800 to $1,300. At this point, I'm not planning to spay her. So what are your thoughts on that one, Ashley?
Would agree with that. Depending on like how you are, like the owner, it's all owner dependent, Helen. I come from the rescue world. We have to spay and neuter before the pup gets adopted, just because there's irresponsible dog owners out there that won't spay and neuter their pets, and then they get lost, and then the whole cycle repeats itself. There are a lot of pros to not spaying or neutering your pet. There are cons. Sorry, guys.
Your dog's very upset about it. He's very upset about the whole idea.
FedEx is here, so that's funny. I don't know. Sorry, we take over, Michael.
You're doing great. I'll take over for a little bit. She's right. Yeah, so there's been some studies with early spaying and neutering that there's an overproduction of something called luteinizing hormones. And so what happens is when these luteinizing hormones can't interact with the sex organs, they start interacting with other things. And so that's it's one of the ideas that is why we're seeing an increased amount of cancer and things like cruciate ligament injuries, skin allergies, anxiety, things like that, because those hormones go towards everything. So yeah, the heat cycles are not that bad. Then I'm with you. It's a tricky area in the animal world, like Ashley was talking about, and with rescue organizations and things like that. And like Bob Barker, it helps decrease the population because that's a big problem right now. That is a really big problem. A lot of rescue places are getting they're overwhelmed, and just more and more of these euthanasias are having to happen because of that. So it's a balance of it, unfortunately. And also we're seeing a lot more just because of veterinary medicine being so expensive that people are getting these pets, especially after, COVID, and they can't afford it. And so they drop them off. And it's a balance. I can always tell if someone's going to be a responsible owner or not. So I'm not going to tell, not every college person, but like a 20-year-old college person that's getting a dog because they think it's fun. I'm going to be like, you probably need to spay or neuter your pet. You know what I mean? So yeah, but there is also something so there are vets that do ovary spaying surgeries and vets that do, what's the male one? I can't think of what the male one's called. All of a sudden, forgot what it was. But I'm going to give you this is the website that has really been helpful. I'll type it in the chat, actually. Vasectomy, that's the word. So this website, so that is going up. So that's a website that you can go to look and see if you have any vets in your area that do ovary spaying surgeries or vasectomies. It's hard to find. I'm in South Carolina and we got one in Greenville. And some vets charge a lot for it. Some vets charge about the same. So I think it's a specialty surgery. So that's something to think about. And then vaccines are really tough. It's tough. The trick is that veterinarians can get in trouble if they have certain pets. I don't know how to word it, but they can get in trouble if they are not allowed to basically say, we're not vaccinating this pet, especially with certain, laws in the state and things like that. So it's tough. If you can find an integrative vet, they're more likely to space out vaccines and support your pet with detoxification of the vaccines. But overall, most pets have that sort of rule because they themselves can get in trouble, especially with rabies. I actually had a client that has a cancer, a 4-year-old golden with hemangiosarcoma, and this dog was given 2 months to live. This dog is now past 2 months and was due for a rabies vaccine. And I literally was like, we're not doing that, correct? And her vets were saying they had to do it. And I was furious, but I really looked into it, and like they're not allowed to make an exemption, but they can do titers and things like that. And so if you're in that area, you can find a vet that does titers, and basically titers, you draw the from the pet, and the titers is able to tell you if that pet is still protected by that vaccine. And they have titers for rabies and they have titers for distemper. So you can, a lot more vets are doing that, but some vets will charge up to $600 for it, which it's not that much. And some vets are really cool and ask, where can I send the blood work to? And there's a place called Kansas State that you can actually send rabies titers to. And usually it's probably about $150 to $200, but worth doing to not have to over-vaccinate your pet. You there, Ashley?
Yeah, can you hear me now?
Oh, I didn't know if you're on mute.
Okay, I was, and I was like trying to talk, and I was like, he can't hear me.
Oh, no, I'm sorry.
No, no. But yeah, I agree with that, Michael. My dogs are on the 3-year rabies and 3 years DHP.
Uh-huh.
But for the next, they're not due until 26. So I'm going to go the tighter route for the rabies because I'm curious. If their level of antibodies are still keeping them immune to it or preventative. So,
Yeah, and I will say, so we did titers a lot at Sundog Cat Moon, and I know at one point they were doing studies for rabies to see if it would last up to 5 years protecting in a dog, and there wasn't enough that it was for them to say, okay, we can do a 5-year rabies, which stinks because I was really excited about that. And I will say that a majority of the pets that we tested would be about the 3-year, 4-year mark where the vaccine would be out of their system. But there's veterinarians that are doing 1-year rabies every single year that it's just not necessary to do. And Lori makes a thank you vasectomy. Vasectomy, it's vasectomy, Mike, it's vasectomy. And Lori has, so Lori said South Carolina requires rabies as a state law, but we can support the body after the vaccine. And absolutely, and Lori is absolutely correct with helping detoxify the vaccine through the body. And that's all I'm going to say about that. All right, let's see. 3 more questions here. Yeah, Becky's right. Becky said, push for the movement to get vet schools to start offering ovary sparing spays. And I think it's going to really start happening more, Becky. I really do.
I hope so. That would be awesome.
Yeah. Oh, gosh. Conscious Kitchen asked me, can you elaborate on the luteinizing phase? Oh, not really.
Like in what way?
What'd you say?
I guess what way does she want it like elaborated on?
Probably more of how the luteinizing hormones are probably, there's more of a production of them if the pets are spayed, which to be quite honest, I couldn't tell you that. I'm not sure. Yeah, this is based off a study from UC Davis.
Yeah.
And that's a question Dr. Roberts could beautifully go down in. Oh, let's see. Becky said, same here. Yeah. You know what I can do, Conscious Kitchen? I can send you information more, because if I explain it, it's going to not make sense probably because I can't get it out of my head. So let me do this. Put your email down there and on the comments, and I will email you, and then that way you can better feel. I'd rather do that and have you better informed. Becky said, same here in Arizona. However, I should mention that I have had success when a vet wrote a letter on their letter stating that it was not safe for my dog to receive the rabies vaccine. Yep. Rabies shot. He had a seizure activity and they were fine. Yeah, and absolutely. It really does. It just varies in the state. It varies in the situation. This hemangiosarcoma dog, I literally have just been recommending them to fly under the radar. And I will say that the veterinarian, when I brought up the rabies titer, they asked where I would send it to. So they were really open to doing that. Yeah, but usually it's got to be a case where it has something like cancer or seizures or something severe like that for the vet to actually write a letter and say it. And a lot of places won't. Like South Carolina, you can get your rabies tag at the vet clinic, but like I know places like California, you got to send all your information to the city and they send you a tag, and it's a whole thing. All right. Rhonda had a question. My dog was diagnosed with cancerous mass that is pushing against his lungs. Oh, I'm so sorry, Rhonda. I've ordered C60 purple powder, which is a great antioxidant, Vitality, which is that mushroom we were talking about, and Heal hemp oil. He is not neutered and has an enlarged prostate. Is there anything else I can give him? Any thoughts on that one, Ashley? Diet's a key thing.
Yeah, I was about to say, going back to the diet, like what you're feeding him, and starting there. And then the C60 is great. I've used that for my pups, and of course the Heal and Vitality. Yeah.
Awesome. Hold on, let me take off. Sorry, I've got to take off Helen's question. Let's see. There it is. Okay. There we go. And I'm going to put up. All right, and that was Rhonda's question. So yeah, so definitely if you aren't doing the original crock pet diet, that is really great to do, Rhonda, and a keto version, because the idea of carbs and sugar feed cancer. So a keto version of the original crock pet diet. I would have a client on the C60. I would have a client on Vitality. I would have a client on Heal. I also have them on, what else am I doing? Oh, gut support is a really important factor too with cancer. So everything basically inflammation-wise starts with the gut. So that idea of leaky gut, the idea that the intestinal walls are compromised, causing toxins to get into the bloodstream, and that can range from anxiety to cancer. So you may want to get on a probiotic like Megaspore. Megaspore is a spore-based probiotic that actually the forming units are in the spore and protected as they go down. And once it's in the gut, those spore release the colony to build a stronger colony to get better bacteria in there, good bacteria in there. And then there is a product called Heartburn TX, which helps realign the mucus layer of the intestines to help rebuild that if there's any leakage. So that may be something else to start with him. So I would do diet and gut control. And they're putting, that's amazing. They're putting I love how they're putting the links on there. That's awesome. Yeah, so we're doing, let's see, cancerous mass that is pushing against his lungs. So we're probably looking at hemangiosarcoma as well, Rhonda, if that's correct. Can go to, bear with me 1 second, because I'm actually going to pull up my treatment plan that I did for Mr. Huck. Is that your dog playing with a toy?
You can hear that? Yeah, it's a little bone. His little shin bone. Whoop. Sorry. It's Nico, a blind baby.
All right, so I'm going to double check everything that I'm doing for this. So let me do this. So if you ever schedule a consult with me as a pet health coach or Ashley, we basically write out a treatment plan for you. I'm going to show you what it looks like. So this is Mr. Huck's treatment plan that I wrote for him. And so Huck's that 4-year-old and had a hemangiosarcoma. And so what I basically do for the client is that I'll go through a little bit of the biology of cancer to help explain further what it's about and how it occurs. And because I think what happens a lot of times with vet clinics, and it's not the vet's fault, they just don't have a lot of time to really explain further in detail your pet's diagnoses because they're backed up with appointments, they're the same thing. So our job is to help empower you more and educate you more and stuff like that. And so I go through the biology of it, and then I go into diet and how this particular diet can help cancer. So this is a keto version of the original crock pet diet. And so, like, for example, we'll go into a lot of the traditional Chinese veterinary medicine aspect of it. So for cancer, I put here, for cancer, I'm designing a keto diet to remove carbs that can feed cancer cells. In Chinese medicine, hemangiosarcomas are considered blood stagnation tumors. Blood is a fluid that moistens and maintains the body's nourishment and carries qi, which is the essence of life, or the force, I like to call it. When there is stagnation, that means that blood is having difficulty carrying qi. This can be caused by liver heat, heart qi deficiency, qi stagnation, blood deficiency. The crock-fed diet itself helps the stomach, which I explained about transforming food into gu qi, and also help with cooling the liver, tonify blood, and resolve stagnation. And then adding in foods that assist that. And so then I go through how to make it, and then go into supplements, which I talked to you about with going into leaky gut syndrome, adding in probiotics, adding in the heartburn TX. Activated charcoal can be used as a binder. So one of the things to think about as well is that when you're using products like Megaspore or heartburn TX, there's going to be a lot of die-off from bad bacteria, which can cause the gassiness or diarrhea. And so activated charcoal is considered a binder, which helps absorb those endotoxins. And you always want to make sure you give that at least 2 hours away from other foods. And then we talked about CBD, which is great, which you're on. I have the Vitality there, which you're doing as well. And then I added in a little bit more of a Chinese supplement. Oh, and that also reminded me too. So Zhuvu Zhu Yusan helps drive out stasis and mansion of blood power, blood mansion, blood palace, persica, and carthamus combination. It invigorates the blood, disperses blood stasis, spreads the qi of liver, and unlocks the channel of pain and all that kind of stuff. So hemangiosarcoma is considered a blood stagnation tumor. So we want to help resolve that blood and nourish the blood. And then also, if you are not already, Rhonda, you may want to ask your vet about adding in a product called Yunin Baiyao, which helps with basically internal bleeding and things like that. So a lot of pets I know are on that Chinese herb that can be really helpful if it is a hemangiosarcoma. So yeah, hopefully all that was helpful. Let's see. All right. So are there any more? If there's any more questions, we'll stand here for a second more. Anything else to add, Ashley?
No, I just remember the one thing Dr. Ruth said or says, and goes for us too, is you can't outpill a bad diet. So definitely what Michael was saying is like starting with the diet. Keto, low methionine diet is also helpful for cancers.
Absolutely. Yeah. And so the thing to think about with keto and low methionine, so it's two different forms of treating cancer, which that was Ashley and I both learning together in the course, because we came upon that where we're like, wait, why? Because they're a little bit of the opposite kind of, but it's just, and that's what, and go on. I'm sorry, Ashley, go ahead.
Oh, no, you're fine.
Oh. Oh, and so they're just two forms of treating cancer. So that's it.
Yeah, depending on the cancer that he has. But yeah, doing the CBD, doing the Vitality, doing all that is helpful and is a step in the right direction. But just main focus is diet, and then go from there.
Absolutely. Yeah. Right on. And a lot of times too, like we have to remember, like sometimes just a diet change can make the world of a difference. Like I remember working at Sundog Hat Moon, the diet alone, we would see dogs change their aggression. They would change their anxiety just because in the terms of Chinese veterinary medicine, we'd be cooling them down some. So you can just see even that much of it. So yeah, so our links, Ashley's link is in the chat section if you want to hire her as a holistic pet health coach. And then I am in there as well. And you can go to Dr. Roberts' store to hire us as well, to buy us at her store as well. And Ashley, do you have any social media things? Do you have people follow or anything like that?
Bark and Bunk, just my boarding business for right now. I don't have a separate one for coaching. It's all in one right now. So Facebook and Instagram.
Likewise, yeah. And then I have Positive Wellness. What do I have? Positive Wellness Holistic Pet Health Coaching Canine Massage. Something like that for Facebook if y'all want to follow. All right. Thank y'all. And thank you. I'm glad we helped. Thank you, Lori. And y'all take care.
Bye, guys. Thank you.